Okay, welcome everyone to this webinar. The purpose of today's webinar is to launch an early version of the Manhattan Manifesto. This is a document of 12 principles that was drawn up after a meeting of digital and e-healthcare professionals and subject matter experts at the UN General Assembly Science Summit in September of 2022. That was hosted by the permanent representative to the UN offices of the Irish consulate. So today we're going to walk through the reasons behind putting together this list of 12 principles, what the 12 principles are, and what our potential future next steps will be. So with that, unfortunately today, the leader of this process, who has been Professor Martin Curley, of the Health Service Executive Digital Transformation Unit at Maynooth University, will not be able to be with us. He was able to do a pre-record for us, and there's a brief introduction to the principles, which we'll be switching over to. And then when that is complete, we will go back to a brief slideshow. Please use the Q&A box to submit questions. And we will try to answer them in this brief 45-minute webinar, which will be recorded and available at some point in the future. So thank you very much for joining us today.
Okay, so the video is coming now.
Hello, I'm Professor Martin Curley of Maynooth University. I'm a member of the Royal Irish Academy, and I'm also chair of the Global Digital Health Leadership Steering Group. In today's webinar, we want to introduce what we call the Manhattan Manifesto. And this is the output of a symposium that we held as part of the United Nations General Assembly 77 Science Summit. This was held the 26th and 27th of September in New York. We want to talk about Stay Left, Shift Left 10X, which we propose as a new paradigm, a new policy, a new platform, and a prescription indeed for wellness and better health. So Stay Left, Shift Left is a new strategy or a new idea for driving a global transition for healthcare improvement using digital technology. Stay Left is about keeping people well, or if you happen to have a chronic condition or need rehab, we can do that best of all from home. Shift Left is about moving patients as quickly as possible from an acute to a community to a home setting. And the idea of 10X is the notion and indeed the phenomena that we've observed. When you apply digital technology to healthcare, which is an information-intensive industry, and you use an exponential innovation methodology, we call it Open Innovation 2.0, you get 10 times or 10X outcomes. 10X faster, 10X cheaper, 10X better, 10X higher volume. So in the webcast today, the webinar, several key leaders of the Global Digital Health Leadership Steering Group are going to explain this manifesto. Just to briefly explain the origin, we modeled the Digital Health Symposium this year on the Solvay conference, which was held in Brussels in 2013, and key leaders such at that time of Einstein and Lorenz and Curie and Planck came together to focus on the major scientific problems of the day. We tried to emulate that in a very humble way by bringing 50 global digital health leaders to New York to work on a new manifesto and a new agenda for fixing healthcare globally. We know healthcare systems are challenged all around the world, both in terms of their financial sustainability and the capacity, and many countries still have issues with availability and affordability. And we felt if we came together, we could put together a manifesto that could accelerate the digital transition of healthcare to make healthcare much more available, much more affordable to many more citizens in the world. And we see three Copernican shifts that are happening. First, a shift from an illness to a wellness system. Secondly, a shift from doctor knows best to patients know best. And then thirdly, a shift from hospital to home. So we think healthcare systems of the future will be more focused on keeping you well, and early detection of chronic disease so we can reverse it. We think the patient, the citizen, will have much more responsibility. It will still be a joint interaction with a clinician. And then lastly, much of the activity that currently happens in a hospital today can be done in a home. So my colleagues, Charlie and Donal and Mary and Carolyn will talk you through the manifesto, but we really want to champion a new era of digital health. And, some of the key principles that we're advocating is all persons in the planet need to have access to integrated shared personal healthcare records. We're advocating the shift of our healthcare system from output-based to outcome-based. So this means we will have accountable care ecosystems where we work together in the network and in the ecosystem to deliver the best outcomes at the most affordable cost for global citizens. And then lastly, we want to emphasize and suggest that governments and national healthcare organizations and indeed private healthcare organizations allocate the appropriate financial, managerial, and legislative resources towards achieving, digital transformation. So I hope you enjoy our webinar today. We will have follow-up webinars in the new year, and we'll have a follow-up to the United Nations General Assembly, both in Indiana in March and in Tampa in April. So thank you for your attention, and please enjoy the contribution from the global colleagues that we will be speaking now.
Okay, so you've heard from Martin a basic outline of what the Manhattan Manifesto is about, and the idea is to champion digital health through collaboration, cooperation, and change. And the key thing there is the first two. It's about collaboration and cooperation. It's a high trust network. It's designed to work where private sector, public sector, and third sector, patients, as well as clinicians, all work together towards one single and achievable goal, which is achieving in the improved wellness of individuals, people, and society at large. So with that, we move into the slides. So policy needs to ultimately change and take an all of government approach to how digital health is implemented. And why is that? Because digital health and the data that feeds digital health and population health touches all aspects of individuals' lives and how government works. And that requires a change from a siloed understanding that healthcare is the Department of Health's consideration to one in which healthcare is the consideration of every aspect of governmental life. And we are looking at enabling universal access to integrated shared care records, a move to outcome-based healthcare. So instead of rewarding purely activity, we're looking to reward improvements in how patients feel and are able to engage in society. And we're allocating financial resources towards that digital transformation. So instead of pushing resources towards continuing to do what we're doing and having a cost explosion and a lack of return, we're trying to bootstrap digital to improve returns and to and have a real change in how we design our health systems. So we have very impressive slides today, as you might have noticed. This is a product of collaboration when you can work together with very interesting people. For those of you that might be joining us from New Zealand, this might look slightly similar to some of your diagrams of the Canterbury, New Zealand model, and that is intentional. This model is an overview of how the manifesto is supposed to work. People are at the very core of it. And out from there, we then radiate into the different types of principles and activities that we need to think about. We need to think about moving towards outcomes, which is healthier people, a move away from hospitals and institutions and towards the home. A current debate in healthcare is that we have a lack of beds. It should not be the case that there is a lack of bed when there's a bed in every home. And that's about moving away from physical buildings and institutions towards virtual systems and virtual services, integration of systems, to end the siloed and fragmented approach to healthcare and healthcare data, to look at a system where you are a passive participant in your health to one where you're an active participant in your health. And the orientation is towards prevention as opposed to cure. This means that you wind up with reduced costs, healthier citizens, and importantly, it changes how you think about healthcare. Healthcare is no longer an expensive service, but healthcare is in fact part of improving your economy. And ultimately, that's about changing how we think about healthcare systems. We have to have a drive towards not just an equality system, but one which has equity, that meets people where they are and changes so that we don't keep missing people, that we don't embed social and economic disadvantage into the system by having a system which is fundamentally unjust. If the system isn't performing for the clinicians or for the patients or for society at large, that's not because there's a flaw in some individual policy. It's because the system needs to be changed from a point of view of justice. A more just system has happier clinicians, better patient outcomes, and improves the overall wellness of society. So from that position, we move to our basic principles. People are at the center. Health is wealth. Recognizing and addressing the unique challenges facing women and girls, very much aligned to the SDGs of the UN. Seeking government support to fund digital health, to fund that transformation from going from where we are now to where we need to be in the future. Providing leadership through a national digital health body to do that coordination, to do that heavy lifting for an all-of-government approach. Embracing the health data governance principles as adopted by the WHO and by the World Bank, so that we have proper governance, that we put in place a structure that protects people, promotes equality, and prioritizes health value. Also, we need to be agile. We need to adopt an approach where we do not look to rigid systems, but we create lodestar priorities and we adapt and change to meet them. We align our funding to a values-based model in which we actually reward wellness as opposed to rewarding activity. And that is not a simple task. It sounds simple, but it's very difficult. We improve our access to data so that we can really move to a population health basis, improve speed and accuracy of data at the point of entry, many times through the emergency department of hospitals, so that patients can be appropriately treated at the point that is most critical and most dangerous for them entering the health system. And we drive towards eliminating disparities in healthcare delivery. And that is about reversing the inverse care law, about addressing the situation for patients of meeting them where they are, as opposed to where the system would like them to be. And ultimately, the final point, which is embracing justice. And that is about creating a just system, a system that doesn't mean that we have inbuilt flaws that let patients down and frustrate and demoralize clinicians, which is very much where we are at the moment. So with that, people are at the center. And why is that important? Well, it's about empowering them, their families, and their communities. And it's about moving from an illness model to a wellness model, stopping thinking about systems as being large buildings and hospitals, and thinking about it as individuals trying to manage and improve their health from the place where they are most comfortable, which is in their own home. Health is wealth. This is, again, a change in thinking about healthcare. In the past, we think about healthcare as a matter for the Department of Health, a matter of expenditure, and expenditure was continuously increasing. And more we are hearing about advanced economies in which aging societies and the cost of healthcare becomes a weight, a burden on the public exchequer, which will ultimately crush it. That is not where this conversation needs to go. And why this principle is here is that we need to think about healthcare as a way of improving the economic performance of our society, and that it's an essential component of economic well-being and economic growth. Healthcare can be a wellspring of productivity growth, and economic growth is driven by productivity. That changes how you treat your healthcare system and digital health. We need to empower women and girls for wellness. It's a crucial component of the SDGs. And it's there because often healthcare systems are unkind and hostile places to women and girls. And that needs to change. And digital health can help with that. We have a target of 6% for funding for digital health. And why is that? Ultimately, that's because when we look at how the private sector and government has changed to adapt to the digital transformation that has taken place over the past decade, they typically allocate 6% of overall expenditure towards that transition. And in cases of crisis, when they're correcting for errors of the past, such as after the global financial crisis, that can rise even to roughly 9% as they put in place new systems to ensure that failures of the past do not take place into the future. At the end of the day, that does require a different way of evaluating expenditure. It also requires structures of government on an all of government basis to ensure that the linkages between that expenditure, the value for money, the outcomes, and the data management and protection is all appropriate, which leads us to the idea of moving to an outcomes-orientated national digital health body. And what is that about? That's providing an organization that can pool talent, pool the organizations that are involved in digital health, and put them on a statutory basis, provide the management of data protection, of data access, of standards and standards organizations, as well as the interoperability of that data between government departments, so that you not only have a situation where there's seamlessness within your health service, but it also enables you to have a situation where citizens only need to provide their data on 1 or 2 occasions in the entire system, so that can be replicated across the system, and that can be a true all of government understanding of citizens, of citizen needs, and to deliver services, high quality services to the citizen at the point at which they want to meet those services in use. So with that, I hand over to my esteemed colleague.
Okay, thanks, Charlie, and thanks, Martin, for setting the scene at the start. I'm just going to talk about two parts. One is privacy and connectivity. So privacy is really important. It's really important, especially in healthcare, because you want to be able to embrace health data. There's a huge amount of data coming with the big data coming, but we need to have governance principles as a step towards global standards. We need to engage communities to have a social license to underpin specific legislation so that we can use and give and share data, but have that controlled by the patient, by the person who owns the data, which is the person in place. We need to have ISO standards for digital health data and to enable cross-sectorial primary and secondary usage of data. What's really needed is an ability to have an ISO standard for a global health record. And what we want to be able to do is to harness digital data so that we can drive evidence-based measurement. It's evidence-based medicine. It's really all about measurement so that we can get better outcomes. So from an engineering point of view, it's also about agile and to be rapid. So one of the points is to be agile, to be rapid, and to drive the step change. So agile development comes with rapid iteration and step functions to give a binary adoption. So it's about making a choice to pivot and communicate and to repeat. So to use emergent design processes, which are quite common in engineering, to apply those in a medical context, a medical system context, and to go for rapid iteration, which is used in many industrial sectors. So that to make experiments to get multiple plausible right solutions and decide which is the best, and really to measure everything, to reward impact. And thank you for Professor Malarkey for these 10 bullet points.
So if you want to change the system, you have to change how it's funded. It's an old maxim, but you get what you pay for and you get what you count. So actually, to make the system work in a different way, we need to align our funding instruments to support a value-based approach to healthcare. The models need to be simplified. they need to be allocative, they need to be data-led and outcomes-driven to enable us flexibly to respond to the needs of the populations defined by the various characteristics, and to support that medium to long-term investment in preventative healthcare and making people have better lives. And by doing that, we can address some of the determinants of health, which are actually outside of the healthcare system's general ambit, but are the things that we can help to change by giving people better information by which to live their lives. If we're going to drive innovation, then we need some clear principles for that funding. We need stability of investment, because without that stability over time, we won't actually enable the innovation that we need to have happen. Healthcare is data rich and generally insight poor, because that data has been held in silos and that data hasn't been integrated and hasn't been connected. We have an opportunity to unleash that global knowledge and take a great leap in our understanding of what does and doesn't work to support populations to be more well and to live their lives in their own homes and their own communities with their own families. And we can work out with this data what does work for people. We can learn fast and move the health and social care system to understanding what needs to happen, and then provide that information to our population so they can make the best possible choices for their lives.
So next we're going to talk about utilizing digital data and looking at the transformation of health data in the digital transformation era. One of the most important things that we have to come together with across the health industry these days in order to truly utilize digital technology and improve health quality is the ability to have systems align, integrate, and have interoperability and speak to each other. So streamlining communications between clinical teams, clinicians, and patients through this digital transformation is going to be key, especially with a closed loop systems that provides feedback and causes minimal harm. We need to give the patient sovereignty. Finally, we talk about it quite a bit, but we've not yet gotten there, but to give them sovereignty and control over their data and allow them to have access and ability to share that data and learn from that health information and take control of their health journey moving forward. Doing this, integrating data is key. We have to bring digital systems together to share insights in order to get operational visibility over the flow of data to allow for analytical insights that reduce harm, decrease time to diagnostics, and to provide a platform for continuous improvement along the way for all involved. That creates improved patient outcomes while reducing cost. It ensures also that we bring security and identification at the core as core pillars of our methodologies that we use moving forward in order to protect individuals and their data. Next, we need to drive toward eliminating disparities in healthcare and health inequities. We talk about that a lot. I've heard this word health equity probably over 1,000 times at a recent conference I was in at the health conference in Las Vegas. And one of the things I realize is that everybody has a different definition for it. So eliminating inequities in healthcare by utilizing digital tools such as telehealth, remote monitoring, and educational services and solutions will truly empower individuals with ownership in their health journey. Providing information to doctors in real time will give them data and access to data that they've never had before as well. Delivering solutions that works for everyone in all communities that especially the most vulnerable and marginalized have in the world is very important. We must remember that we must keep, as Martin said earlier, everyone involved and everyone included in these solutions as we start to think through them and deliver them. And we have to think about how do we deliver these solutions in order to make sure everyone will have access to them. We have to provide necessary pathways for healthcare to reach all individuals, regardless of their ethnicity, location, or socioeconomic status, who are unable to get the proper medical care due to barriers, whether financial or whether other. And next, we talk about, and last, but definitely not least, we talk about embracing justice. Again, many of the colleagues have spoken about this and touched on this a bit. This is an initiative to really ensure all is included. A fair chance for all by managing the complex relationships between inequities that persist, disadvantage arising from the social determinants of health and their impact on disease. This is something that we've seen rampant through decades, and it's time to get our arms around it. Gaining all of government support for broader interventions on inequity and by setting clear goals backed by transparent legislative measures and inclusive accountability framework is going to be key for us to have success in this space moving forward. And we look forward to all of you joining us on board.
So, you've now been introduced to the 12 principles that a group of us in New York City discussed and agreed upon, and have now presented to you. Again, we close with this image because the key takeaway for those of you that are watching this is the foundation upon which it is all based, and that is wellness. The goal of this process is not necessarily to talk about systems, it's about talking about people. And the goal is to have wellness and create opportunities for wellness for people. And that's at the center of what we're trying to do. It's the foundation and it's our goal. We hope that you continue on the journey with us. If you do have questions, please feel free to contact us. As Martin stated, there is going to be a conference in mid-March at the Purdue University Policy Institute, which will involve the former US Surgeon General and Irish officials, as well as global digital health leaders. And then there will be events in New York, again at the United Nations, for the Science Summit for next year, in next September, as well as a conference in Dublin in June and a conference in Tampa at the University of Central Florida in April. So please do contact Martin Curley at the Irish Health Service Executive if you have more questions and would like some more information. And I'm left to thank my colleagues who have worked with me on this diligently and patiently, to Donal, to Mary, who's joining us live from New York City, but is not with Saturday Night Live, and for Carolyn, who is joining us temporarily in Britain and Ireland, but will be returning to New Zealand shortly. And to finally thank the Royal Irish Academy, the Learned Society for Ireland, who has been acting as host for the in-person conference, which took place earlier today, and host for this webinar. As we would say in Irish, thank you very much. Gar míle mágat.
Thank you.
Thank you.
Thank you all.
Thank you.
Thanks.